The latest on COVID-19 now. The Nigeria Center for Disease Control, the NCDC, reported 133 new cases of coronavirus overnight, taking the country's total number of cases to 61,440. Lagos State recorded the highest number of cases with 90 new infections, followed by Rivers State with 13 new cases, while the FCT and Kaduna each recorded 8 new cases. So far, 56,000, I should say, 611 people have been discharged, while 1,125 people have died from COVID-19 complications. Last week, the Lagos State government revealed that 181 students and staff of a private boarding school in the Lekki area of Lagos State have tested positive for COVID-19. Commissioner for Health, Professor Akin Abayomi, while giving details of the investigation, explained that a 14-year-old SS1 female student fell ill on the 3rd of October and was sent home after receiving first aid at the school. He added that the student subsequently tested positive for COVID-19 in one of the accredited private labs in Lagos. And while the state government says the situation is under control, the big question remains: how can schools ensure that the virus doesn't creep in? Joining us via Skype now is Dr. Alera Roberts, the second Vice Chairman, Association of Public Health Physicians of Nigeria, Lagos Chapter. Dr. Roberts, Professor Roberts, thank you very much for joining in at this time. Well, the government here in Lagos is saying most of the patients in this particular case, most of this people that tested positive are asymptomatic. No one has had any need to be admitted in hospital. But then it is quite serious. It is quite significant, says the government. What do you make of that?
Thank you very much for having me, and a slight correction, Dr. Alek, it's not Professor. And yes, we did hear the students who tested positive in a private school in Lekki. It was to be expected. They have handled it exceedingly well. The child who did get ill, for all we know, could have been a coincidental illness and not necessarily related to COVID. But let's delve into her private medical information or private medical condition. The issue is that what do we do about it and what can be done to mitigate the spread of the disease? First and foremost, I must say that school in and of itself becomes an isolation center. So long as strict movement in and out of the school to what is absolutely necessary, then the school itself becomes the isolation center, and you can now continue to monitor the spread of the infection. And those who become infected, being infected doesn't mean that they necessarily get ill. That's the thing that we have to remember. These are largely children, young people. They do get the infection, but they may not manifest any serious signs or symptoms of disease. So long as the epidemiology and surveillance unit of the Lagos State Command Center can continue to monitor them and make sure that those who do get ill or do start manifesting any symptoms can be escalated, can have their care management escalated, by and large, handling it extremely well. But then again, this is an administration that works on the science, isn't it?
All right, and then, of course, the concern for many, the government has said there will be a new wave of the infection if, relevant techniques, safety protocols aren't adhered to. And, of course, there are concerns about how well Nigerians are adhering to this persistent warning. What's your take?
Well, it's very difficult for us right now because you are very right. If we don't adhere to the public health guidelines of social distancing, hand washing, regular hand washing, and the wearing of masks, then yes, we will be looking to a second wave. Now, the question then becomes, looking at our first wave and the numbers that we reported, how bad will the second wave be? The main thing that we need to look for in all of this is, can the health system cope with an overflood of cases? Do we have enough hospital beds? Do we have enough healthcare providers to provide care for a second wave? And we've done a lot of work, at least in Lagos State. We've done a lot of work to ramp up our care, health service delivery. We're not all the way there yet, but we're certainly a long way away from where we were back in April when this started. But we do need to adhere to the public health, because things work. These are very, very simple guidelines to wear a mask when you're outside the house, avoid crowded places, wash hands regularly, and use a sanitizer when you can't. These are simple things that we have put in place that have worked for us to date, and we just need to adhere to them. It's a little bit longer, just the way we threw out polio, just a little bit more, and we'll have this one